why cervical sonography is essential in pregnancy. Cervical sonography, I personally believe that it is a part of first and second trimester sonography, which is usually ignored. It is not given that much time, and usually the pathologies of cervix are ignored. As we know that there are different parts of uterus, like the corpus of the uterus, and we have got cervix. Usually in pregnancy, as the fetus is there or gestational sac is there in the endometrium in the body of the uterus, so we usually, as sonographers or sonologists or radiologists, we look at the fetus, we look at placenta or gestational sac, amniotic fluid, cardiac activity, and we don't look at the main door, which need to be closed to protect the fetus to stay inside the uterus till it is delivered with pains, or if there is no labor pain, then it can be delivered by a cesarean section. So before the pain start or the time of delivery, we need the door to be closed. The door is internal and external os of the cervix. So the first thing is it is mostly ignored, and I usually think that we must spend about 2 to 3 minutes assessing the cervix before going to the body of the uterus or gestational sac or whatever is there. We can have different pathologies in the cervix, but today the main topic is about the role of cervical scanning, and most important thing is preterm labor. So if the cervix is not good, is not patent, is not properly protected, or is short, it can be congenitally short, or it can be due to many other reasons which we will discuss. So the lady can have preterm labor, and we can face an abortion in the end of first trimester or in early second trimester. The causes of preterm labor are 75% of perinatal mortality and 40 to 50% of neurological handicap. We use different diagnostic tools for prediction of preterm birth, and digital examination of cervix is one of that. Then we can use sonographic evaluation of cervix. We can have fetal fibronectic assay in cervicovaginal secretions. We take a swab from the cervix, which are the cervical or cervicovaginal secretions, and we look for fetal fibronectic assay to assess if there is any chance of any abnormality. So out of these, digital examination of cervix, sonographic evaluation of cervix, and fetal fibronectic assay, we have seen that the most important thing is sonography, which can help us. For the prognosis of preterm labor, there are 4 things which we have to keep in mind. The first is cervical length, fetal fibronectin, which we just discussed that we look in the cervicovaginal secretions, Bishop score, which is scoring for the cervical incompetence, and premature contractions. If we find any premature contractions, that can also indicate that the lady can have a preterm labor. How these preterm contractions are diagnosed, the patient will come to you with lower abdominal pain and off and on pains, so we can diagnose it clinically. The sonographic diagnosis of cervical incompetence, we prefer to have TVS examination of cervix, the best imaging modality for detection or exclusion of patients at risk for preterm birth. So TVS is very important. We consider the assessment of cervical length, shape of the internal cervical os. So in practice, most of us are measuring the length of the cervix, but we rarely bother about shape of the internal cervical os. We have to look at its appearance also. For prediction of preterm birth, which may minimize perinatal morbidity and mortality, the shorter the cervix, the greater the risk of preterm delivery. So we have to look for its size, We usually take about 1.5 to 3.5, and in some studies we take about 4 centimeters as normal.